Hello and welcome to this special edition of the ACC Update. I'm Dr. Bill Otchen, and we're talking about Million Hearts today. The ACC is a partner in Million Hearts, a national initiative launched last year by the U.S. Department of Health and Human Services. The aim is to prevent 1 million heart attacks and strokes by 2017. The Centers for Medicare and Medicaid Services and the Centers for Disease Control and Prevention co-lead Million Hearts. The organizations work with public and private partners to improve heart health through community efforts and to achieve excellence in the ABCs. The ABCs are aspirin for people at risk, blood pressure control, cholesterol management, and smoking cessation. The ACC is proud to be a founding partner in this Million Hearts initiative. Joining us today is Dr. Janet Wright, Executive Director of Million Hearts. Janet, welcome back to the studio and congratulations on a successful first year in Million Hearts.
Thanks, Bill.
What efforts have contributed to the success of the Million Hearts initiative in the past year?
Well, you know, I think the most impressive one that I know is the amount of engagement that we've gotten in just the first year. The goal speaks to so many people, either because of a personal experience or a professional one in the case of the members of ACC. So we just crossed the 10,000 pledge mark at the end of August. We've got 55 partners, all of whom have made very serious commitments to preventing heart attack and stroke. And I think the other thing is that we've been able to contribute to the literature about performance gaps in the ABCs. And also some of the things that can help improve care. There's a community guide to preventive services that came out with a recommendation for team-based care. Now, cardiologists and nurses have been practicing team care for a long time, but to see a systematic review of 77 studies saying that physicians, when associated and working together with nurse practitioners, PAs, community health workers, pharmacists, and others really improve the care of high blood pressure, get people under control faster.
Well, that's great. That's a wonderful first year. Preventing 1 million heart attacks and strokes over the next 5 years is quite ambitious. What do you think needs to happen to achieve that goal?
You know, I think the first thing is we have to decide that getting excellent in the ABCs is our business. Part of the problem, especially with blood pressure control, is that it's not always clear whose job it is to help get that patient under control. So clarity around that will help. We know that, like I mentioned, enlisting a team of folks around getting excellent in the ABCs, using an electronic health record if you have one to assist you, and then focusing on things like medication adherence. We know those are all major ways to move the ball forward.
And Million Hearts is not just focusing its efforts inside the physician or the practitioner's office, is it? There are other efforts in the program.
That's
Can you
right.
Tell us a little bit about that?
Absolutely. So there's a whole community prevention set of actions, and those are targeted at smoke-free workplaces, policy changes that would create smoke-free places, work or not, work or play. Also working to reduce sodium content in the food, so working with the food industry and the restaurant industry, and then finally trying to eliminate trans fat in the food.
Well, those also are very laudable efforts. Do you have any specific advice for physicians and their patients to focus in on the blood pressure control, which I know is really the first focus of the Million Hearts initiative?
That's right. What we've come upon, what we now understand, is that in the U.S. there's 67 million of us with high blood pressure, and the control rate is less than 50%. In fact, there are 36 million of us with uncontrolled hypertension. One of the scariest numbers when you break down that 36 million uncontrolled is that 14 million have high blood pressure and don't know it. Even though there are multiple elevated pressures on a record, when you ask them, they've never either been told or they didn't absorb the message that they have high blood pressure. Another 16 million are on treatment, so they know they have it, but they're still not less than 140/90. So we've got a big opportunity, and in fact, we've done some predictive modeling that of that 36 million uncontrolled, if we can move at least 10 million of the uncontrolled to under control, that will contribute mightily to the million prevented heart attacks and strokes.
And my understanding too is that on a population basis, the blood pressure, the systolic blood pressure does not have to come down that low to have remarkable gains.
That's right. Even 5-6 millimeters makes a big difference, not only in the event rate, but actually in the death rate. You know, Bill, there's one other thing that was published in the Vital Signs report at the beginning of the month, beginning of September, and that was that 89% of the people who are uncontrolled have a usual source of health care, and 85% are insured. So these are not people who are out of a care circle, if you will. There's a great opportunity to grab those folks and help get them under control.
Well, that's certainly true. That should make the task easier. And I think the one figure that is striking to me is the 14 million people who have blood pressure, documented blood pressure problems, but they don't realize it themselves, or they don't communicate it.
Right.
That's a scary number.
It is. And you know, as you mentioned, one of the efforts, we have a 110-point plan, believe it or not, to try to get our arms around blood pressure control. And one of the things is to extend the measurement and the detection, if you will, of high blood pressure out into the community. So if you might get a diagnosis, you certainly get a diagnosis in a physician or nurse's care, but you might be able to detect an elevated pressure out in the community. So where you go to church or synagogue, where you work out. I personally think that in order to get money out of an ATM, you have to get your blood pressure checked. Maybe a stretch.
Is that goal number 111?
Probably so.
Yeah. And of course, barbershops too.
Exactly.
Particularly in the African American community, have been very effective in the measurement of blood pressure.
That's right. That's right. So it's sort of pressure to the people. Let's get those cuffs out where people can access them. And then the important thing is to get those numbers back to the healthcare professional that person's chosen as a blood pressure coach.
Well, I'll tell you what, this is very exciting, and I love talking to you about it, and I really appreciate your coming and joining us for a couple of minutes to tell us about Million Hearts.
Well, Bill, we appreciate the college's commitment, and especially the chapters coming on board. It's been fantastic to have them.
Yes, that's a very good point. The chapters have really taken this on and embraced it under Dr. Ichiporia's leadership. We're very pleased with that.
Right. Thank you.
So thanks again. Now, more information about ACC's partnership with Million Hearts is available at cardiosource.org/Million Hearts. That's all for this edition of the ACC Update. Continue to stay tuned to CardioSource for all of the latest news from your college. Thanks for watching.